Welcome back to the OT Miri channel. My name is Miri. I'm a licensed occupational therapist, and in today's video, I'll be talking to you guys about Quervain syndrome, also commonly referred to as the mother's thumb. So as you might guess, the inspiration for today's video and topic comes from my own wrist pain that I experienced shortly after giving birth to my son Noah and caring for him. So what is Quervain syndrome? It's a Stenosing Tenosynovitis of the first dorsal compartment of the wrist and the abductor pollicis longus and the extensor pollicis brevis. So in other words, there are two very important tendons we need to know when talking about the Quervain syndrome, and those are the abductor pollicis longus and the extensor pollicis brevis. These two tendons are housed in the first dorsal compartment of the wrist, meaning they course through or pass through the first dorsal compartment. And these two tendons work together for thumb movement, specifically to abduct, that's abduct, and extend the thumb. Now, when there is a thickening of these tendons and the tendon sheath in that small space, what do you suppose will happen? Well, there's only so much room to work with. So when there's a thickening of the tendon and the tendon sheath, there will be a stenosing, or narrowing of that space or the canal, and that will subsequently lead to and resultant impaired tendon gliding. So the tendons won't be able to glide as freely as it before because that area will be constricted. All right, so hence Stenosing Tenosynovitis of the first dorsal compartment. So what are some of the symptoms of Quervain syndrome? Well, for one, there is pain and also tenderness, and sometimes swelling can be observed right over that radial styloid. So radial styloid is located on the radial side of the hand, which is the thumb side, at the base of the thumb, specifically in the first dorsal compartment, right over that radial styloid. And this pain can radiate to the thumb or to the distal forearm. All right, and this pain is intensified or exacerbated with repetitive thumb and wrist movement, particularly movements that involve thumb abduction. So that's thumb abduction, moving the thumb away from the hand, performed simultaneously with wrist ulnar deviation. So that's moving it down like that. Ow, see, that hurts. All right. Okay, so what are some causes of Quervain syndrome? Well, the exact cause and etiology is oftentimes unknown, but there are several associated risk factors, including certain medical conditions like rheumatoid arthritis or diabetes, also pregnancy. So women who are pregnant are at higher risk. And speaking of women in general are disproportionately affected. So women are 4 times more likely than men to suffer from Quervain syndrome, and also age. So those in the age ranges of 35 to 55. And also, this is not as common, but direct trauma or injury to the wrist has also been implicated. And last but not least, Quervain syndrome is considered a repetitive strain injury. So when there is a cumulative microtrauma to those tendons through work or any sort of occupations that involve repetitive thumb and wrist movement, so think gripping, grasping, pulling, pushing, lifting, all of which uses a lot of hand, wrist, and thumb movement and puts strain right over that tendon area, that will exacerbate the pain and lead to Quervain syndrome. And that's why this is oftentimes known as and referred to as the mother's thumb, because if you think about new moms caring for their newborn, they are constantly engaged in activities that use their hand and their wrist. And so when I'm holding Noah by the waist to lift him up, I will often have my hand, my thumb extended and abducted around his waist. And as I'm lifting him up, my wrist ulnarly deviates, and I do that countless times in the day. All right. And thinking about mother's role, there was another thing comes to mind, which is breastfeeding. So when I was breastfeeding Noah, there was nothing natural about it. It was so hard, perhaps my greatest challenge, because you have one hand that's holding the baby, another one that's like grasping your breast, and then my thumb is abducted and extended to the max with my wrist ulnarly deviated as I'm supporting the weight of my baby. And I would stay in this position sometimes for hours on end. And so prolonged, static, awkward posture position is also implicated and can exacerbate that pain and put strain and stress over those tendons, leading to dead Quervains. All right. Some other terms that this condition is known for is texting thumb. Same concept as the mother's thumb. So when we're holding our phone and texting all day, sometimes multiple times a day, how are we holding our smartphone between our hands? With our wrist ulnarly deviated, right? And our thumb is abducted, and we're constantly moving that thumb up and down. So repetitive, cumulative microtrauma. Gamer's thumb is another one that dead Quervains is known for. Same concept as texting thumb. And let's take it back over 100 years when this used to be called the washerwoman sprain. And before there were washer and dryer, when people had to manually wash their clothes, there was a lot of opening and closing and gripping and grasping as they're washing the clothes. And that involves a lot of thumb extension and abduction, while simultaneously deviating their wrist ulnarly. So thinking about wringing your clothes, right? You're twisting your wrist. And so remember what I mentioned earlier, this is really exacerbated by thumb abduction and ulnar wrist deviation. Well, manually washing your clothes will definitely exacerbate the pain. Okay, so if you can't really remember what dead Quervains is, just think about these terms that will make it really easy for you to visualize the movements involved in dead Quervain syndrome and what makes it worse and the area that is impacted. Okay, so how do you assess dead Quervain syndrome? Well, it's a very easy, simple, fast test. It's called a Finkelstein's maneuver, where you basically bring your thumb into your palm and you make a fist over it, and you would ulnarly deviate that wrist. I think and if you experience pain, you are testing positive. So a side view, you bring your thumb into your palm, make a fist, and you ulnarly deviate. Actually, I didn't. Did you guys see that? I compensated. I didn't want to do it again, but you guys get the point, right? And one of the things that I used to sing all the time, so much so that my husband actually knows this song, and occasionally, even now, he'll sing it, and I think he's mocking me, but it goes like this. Dead Quervain, the tendon pain, let Finkelstein assess your pain. So as we know, this injury or this condition is related to the tendon that causes a lot of pain on your wrist, particularly over the radial styloid. And who's going to come and assess the pain? Finkelstein. So dead Quervain, the tendon pain, let Finkelstein assess your pain. You guys are going to think I'm really weird. All right, so you test positive for Finkelstein's. What next? What are some conservative approaches? Well, for one, we can use the forearm thumb spica split, so forearm-based thumb spica split to give that wrist some rest, immobilize the thumb, prevent wrist ulnar deviation, and what we would do is place the wrist in neutral with the thumb radially abducted, and we would keep it in there for about 3 weeks, at which point the patients may progress to a softer splint and even begin some isometric exercises. And this thumb spica splint is also oftentimes used in conjunction with a corticosteroid injection. That would be the medical management or medication management, where it's just a one-time corticosteroid injection, and studies have shown that it's highly effective for a lot of people. What are some other occupational therapy interventions? Activity modification, right? And so avoiding movements and activities that would exacerbate the pain even more. So avoiding a lot of pinch and forceful gripping, and being mindful of body mechanics. And for me, this was actually really hard. It was hard for me to take my own advice, because I can't look at a hungry baby and say, sorry, I'll feed you tomorrow, wait a little bit. right? But I had to really take into account body mechanics and give my wrist as much rest as possible. And every time, you know, I was breastfeeding him, I was trying my best to keep my wrist as neutral as possible and avoiding activities like texting as much as possible, or other activities that was exacerbating the pain. All right. Now, when these conservative approaches do not work and they fail, there's always the last resort, the surgical release of the first dorsal compartment. And this is an outpatient procedure where a surgeon will make a small incision over that first dorsal compartment to relieve the pressure so that the tendons can glide better. Okay. And post-operatively, the intervention looks similar to conventional, so a forearm-based spica splint, but the difference would be that instead of cutting that wrist in neutral, we would keep it slightly extended at 20 degrees with the thumb still radially abducted, abducted. And simultaneously, within a few days post-operatively, we would want to do some tendon gliding exercises and a gentle active range of motion. And 2 weeks later, we can begin to do some strengthening exercises, particularly grip and pinch strengthening, and incorporate some desensitization techniques, as well as scar management if needed. And around 6 weeks, patients can generally resume normal activities. All right. Oh, I think that's it. So that's Quervain's overview for you right there. I hope it was helpful. And oh, one more thing. I get this question often on all my hands and upper extremity injuries video, where you guys ask me what is a good resource. This is the book that I use all the time. I reference this one. It actually comes in 2 volumes. I can't say that it's an easy leisure reading. It's actually quite dense. But if you really want to delve deep and understand some of these injuries, the anatomy, the pathology, and just really want to get into hands and upper extremities, this is the book that I would recommend. Now, the next question you will, I'm sure, ask is this good for studying for the certification exam? I didn't use it when I was studying for the certification exam. I think personally it might be too much information, but I do think that if you're practicing, or if you really want to get a good understanding of certain injuries, these 2 volumes will definitely give you more information than you will ever need. So I highly recommend it. I'll put it in the video description for those of you who are interested, along with my study notes that supplement this video. All right. Okay, time to take a break. I'm tired. My wrist hurts and I want to take a nap. All right. I hope you guys all are doing well. Study hard, but not too hard. Make sure to take lots of breaks, do lots of self-care. And until next time, I love you guys. Take care. Bye.